Thank you, Mr. Chair. And let me start by thanking you and Representative Brownlee and the department for your efforts to advance abortion counseling and care for veterans. And I think I speak for the majority of Americans when I say a woman should be in charge of her own reproductive health care, her future, her life, and that medical decisions should be made by a woman with her doctor, not by politicians, especially politicians who have no idea of the circumstances of her life. And I'll just say simply that abortion is part of health care. And, it's sort of, today I believe in access, obviously, to full reproductive care for all women. Today we're talking about women veterans. And think about it. Some of them willing to risk their lives. They were there standing up for our freedom. Don't they deserve their freedom? And isn't that what we're talking about? The freedom of women veterans to determine their own future? So thank you, thank you, thank you. Representative Aldred had some questions I want to follow up on, just in terms of how this thing gets implemented, because the concept to me is the right one. The package, the benefit package now, does that mean that the VA will pay for counseling and for abortion care for all veterans?
So, Congresswoman, abortion counseling will be made available to any veteran, and abortion services would be limited to situations clinically where the life or health of the mother would be put at risk if they carried to term, or in cases of rape and incest.
Okay, and I'm assuming that is up to a doctor's determination.
Yes, ma'am.
Okay, and I'm from Florida, so like Representative Aldred, I have to deal with a very oppressive, autocratic governor and state legislature that think they should be in charge of women's lives. And I think they would do anything to try to, to put obstacles in front of this new policy. Under your program, would a woman be able to go? And a doctor would be safe from the legal restrictions at a VA clinic? What about at a private doctor's office that is doing work for the VA?
Well, Congresswoman, where you have our federal employees doing clinical work on our property, VA property, they would be protected under federal supremacy, and the full force of the federal government will be there for them should they be challenged on that. When it comes to community providers, those protections would not necessarily be available. And so that is where we have to factor in with our implementation plan ways that we can deliver care to those veterans in those states, including possibly transporting them, should they qualify for travel benefits under our medical benefits package more generally, to VA sites or community providers that can do this work.
Yeah, I think that's especially going to be challenging for women who live in states like in Florida. If you live in Miami, Florida, the next state that allows abortion care is literally hundreds of miles away from Florida. And you probably find that around the country. There's certain parts of the south part of the country, parts of obviously the Midwest, women who live in rural areas, those are all going to be problematic. So I hope you're going to really focus in on that. And I have 46 seconds to ask one more question, which is, is contraception now going to be fully paid by the VA or still requiring co-pays?
I'll defer to Dr. Hayes to answer that question.
Thank you. The contraception copay is still in existence. We can give you additional details of how that runs under the regulations and why that is still pending within the VA. We did submit a supportive legislative request to have contraception copays removed.
All right, I think that's a good idea. Does it have to be done by the Congress, or can your department do that?
I think that's best handled in a written response to outline for you how exactly that might take place.
Okay, and may I just respectfully suggest that that's a good idea, to get that done. Thank you. I yield back. Mr. Chairman, that's another initiative for you.
Mission accepted.